Mesothelioma survival rate. Approximately 55% of mesothelioma patients live longer than 6 months, while roughly 35% live longer than 1 year. Only 9% of people diagnosed with mesothelioma survive longer than 5 years. How long can you live with mesothelioma? This question is commonly asked by those who have been diagnosed with mesothelioma, a fatal form of cancer caused by asbestos. Unfortunately, as with most diseases, there is no one answer to how long a mesothelioma patient will live. Survival rates for mesothelioma are improving. The good news is that survival rates for mesothelioma patients are improving. A 2015 meta-study looked at 20 years' worth of results from 1990 to 2012, and during that period the two major forms of mesothelioma, pleural and peritoneal, have both seen an improvement in survivorship. According to the study, peritoneal mesothelioma survivorship has especially shown significant improvement, largely due to new forms of treatment, such as hyperthermic intraperitoneal chemotherapy, HIPEC. The effect of treatment on survival. The type of treatment a mesothelioma patient receives can affect survival rates. Whether this is due to the treatment itself or to other factors, e.g., if the patient is too ill to undergo a more aggressive treatment, may not always be apparent. While there has been no single study showing survival rates based on treatment across all types of mesothelioma, separate studies have been done on the two most common forms of mesothelioma. For pleural mesothelioma, patients who undergo a pleurectomy/decortication, P/D, or extrapleural pneumonectomy, EP, both of which are usually part of a multimodal treatment plan, generally have a much higher rate of survival than those who receive chemotherapy alone. For peritoneal mesothelioma, patients who undergo cytoreductive surgery, CRS, with HIPEC have significantly higher rates of survival. When combined with systemic chemotherapy as an adjuvant treatment, the 5-year survival rate of patients who undergo CRS and HIPEC can be as high as 67%. Other survival rate factors. The survival rate for mesothelioma patients depend on a variety of factors. These include things such as the patient's age, health, and the treatment they receive. Every individual case is different, and one survival rate may not necessarily apply to a specific patient's case. Stage at diagnosis. Mesothelioma staging can impact survival rate significantly. Patients diagnosed at an early stage, stage I or stage II, have a much higher survival rate than those diagnosed at a later stage, stage III or stage IV. For example, the 5-year survival rate for stage I peritoneal mesothelioma patients is 87%, but only 29% for stage IV. Age of the patient. Younger mesothelioma patients have higher rates of survival than older patients. This is due in part to the fact that older people in general have lower survival rates. In addition, with age comes a variety of health-related conditions that can make a mesothelioma diagnosis more deadly. Sex. According to data provided by the National Cancer Institute's SEER database, women have a higher 5-year survival rate, 16%, than men, 9.3%. It is not entirely clear why this is so, though some reasons may include that women are generally diagnosed at a younger age, they are more likely to get regular medical checkups, and they may be in better overall health. Race. There is some evidence that African Americans who have mesothelioma have a slightly longer 5-year survival rate than Caucasian mesothelioma patients. However, because Caucasians have a much higher incidence of mesothelioma, there may not be enough cases of African Americans who have the disease to make a substantive determination. Genetics. Several studies have shown that certain genetic factors can affect survival rates among patients. For example, mesothelioma patients who have certain mutations of BRCA1-associated protein 1, BAP1, appear to have much better survival rates than other individuals who develop the disease, according to one study.